Hello guys. Welcome to the channel, let's crack it. Yes we can. In this video we are going to check some test questions for NCLEX-PN, that is, National Council Licensure Examination for Practical Nurses. As you would be knowing, you need to pass this exam to become a licensed practical nurse in Canada and the US. This exam assesses your knowledge and skills to ensure you are ready for safe and effective nursing practice. The exam consists of multiple choice questions, as well as other formats such as fill in the blank, drag and drop, and ordered response. The exam may have a minimum of 85 questions and a maximum of 205 questions, depending on your performance. Candidates have 5 hours to complete the exam including breaks. Take time to analyze each question carefully. Once a response is submitted, candidates cannot return to that question. The ultimate trick to crack this exam is to practice as many questions as you can so that you become familiar with the question format and timings. So, without any junk talks, let's jump into looking some test questions. Question 1. A patient with diabetes is experiencing hypoglycemia. Which of the following symptoms should the nurse expect to see? A. Polydipsia. B. Confusion. C. Polyuria. D. Weight loss. Correct answer. Option B, confusion. Hypoglycemia can lead to symptoms such as confusion, irritability, sweating, and shakiness. Polydipsia and polyuria are associated with hyperglycemia. Question 2. The nurse is preparing to administer a medication that requires the patient to be in a sitting position. The patient is currently lying down. What should the nurse do first? A. Administer the medication and document it. B. Raise the head of the bed and assist the patient to sit up. C. Call the physician for a different medication. D. Wait until the patient is ready to sit up. Correct answer. Option B, raise the head of the bed and assist the patient to sit up. It's important to position the patient appropriately before administering medication to ensure safety and effectiveness. Question 3. Which of the following interventions is most appropriate for a patient experiencing acute pain due to a fracture? A. Administering a prescribed analgesic. B. Encouraging deep breathing exercises. C. Applying heat to the affected area. D. Performing passive range of motion exercises. Correct answer. Option A, administering a prescribed analgesic. Administering analgesics is the most effective way to manage acute pain. Heat is typically not applied to a new fracture due to the risk of increased swelling. Question 4. A nurse is caring for a patient who has just had a total hip replacement. Which position should the nurse avoid when positioning the patient? A. Supine. B. Lying on the unaffected side. C. Lying on the affected side. D. Sitting with the legs straight out. Correct answer. Option C, lying on the affected side. The patient should not lie on the affected side to prevent dislocation of the new hip joint. Question 5. A patient with congestive heart failure is prescribed a low-sodium diet. Which food choice indicates that the patient understands the dietary restrictions? A. Canned soup. B. Fresh fruit. C. Processed cheese. D. Potato chips. Correct answer. Option B, fresh fruit. Fresh fruits are typically low in sodium, while the other options are high in sodium and should be avoided. Thank you guys. That's all for the very first video of NCLEX exam sample questions. Please like, subscribe and hit notification button to get more videos on the sample questions. I hope you like the video. Thanks again.